we call classic peripheral neuropathy. That's part of a consequence of aging for most. It's a hereditary thing, lots of stuff. Obviously, you're a very active individual. My major concern, is what we were just talking about and what I ended with, is it sounds like you're malnutritioned, but that's the primary issue. An issue with peripheral neuropathy can be as simple as vitamin deficiencies. And if you're not intaking a standard diet, particularly things that include the vitamins that are necessary, your body processes will just start to shut down, which will include, injury to your peripheral nerves. You'll feel tired, fatigued, muscles just don't work right. You're not feeding yourself right. Your body doesn't have fuel. That's a lot of what I'm hearing ultimately, and I think that
that makes sense.
The primary issue is probably that, honestly. So you probably do have a peripheral neuropathy, but I think the cause of that is a nutritional deficiency for you, and this just, like, I get it, gut issues. You're like, well, I don't like that. I can't function with this consequence, so I just won't eat. And then you get used to that. You become accustomed to it. You stop being hungry. And then as a result, then you become malnutrition, right?
That sounds like me.
In particular, that even when you do eat, you're only eating, basically what I heard is carbs. Vegetables are carbs most of the time.
I have salads. But
yeah, which is, well, salads can be carbs, like carrots are basically carbs. Lettuce is basically fiber, right? There's not nutritional content to lettuce. Spinach is good for you. It's got good nutrients. So it really depends on what it is that you're eating. But if you're eating only pasta and not, I'm not a big fan of dairy, but at least it does have some protein in it. It's got some content to help fuel your body.
Cheese.
Okay, so you're probably getting most of your protein nutrients from cheese. And cheese has got its own mixed bag of problems related to it, but at least you're getting something. Your body probably would have done worse to this point had it not been for that in reality. So what there needs to be is work on, and this typically requires a nutritionist, honestly, because this system is complicated for you. There's lots of intolerances to food. There's obviously allergies or GI consequences to certain things you eat. And there's also avoidance behaviors related to textures probably and these other things, right? Like you said, if I don't have to cook the chicken, I'll eat it. But the chicken grosses you out when it's in uncooked form. My wife's the same way. She does not like uncooked chicken. So those things will have to be overcome. And you can take vitamin B, for instance, like you can get injections and see if that helps you, right? That might help your neuropathy symptoms, but it won't be enough by itself to correct all of these issues. Your diet will have to come up. Water intake will have to come up. Protein will have to come up. All of those things. And that's going to take help for you because it sounds like it's complicated.